next comes are diseases like diabetes, pneumonia, arthritis, obesity, etc., etc. Risk factors are attributes that increases your chances of getting these diseases, while causal factors are attributes that ensures that you surely get these diseases. For more elaborate distinction between risk factors and causal factors, please stay tuned and reason with me. Hello everyone, welcome back to my channel. My name is Uche-Duruibe, and this channel is basically about health. Yes, I am not just passionate about health and well-being, I'm also a master's degree holder in public health. So this channel is dedicated to everything about health, especially the prevention and then awareness creation when it comes to health. Yeah, there are little things you may find me making my hair or cooking food, but those are secondary. The basic thing on this channel is health, how to prevent it, how to take care of us, and then how to be aware of certain conditions that may come to us in the future, and then we discuss how to handle it. To my old subscribers, I am so thankful that you keep coming back. Honestly, I am really thankful. To my new viewers, please click the subscribe button. Please listen to me because I will be explaining things about health in a layman's language, no medical jargons, but for us to understand it, because that's how passionate I am about health. Please like my videos, share it with your friends, and let us spread the good news of health to everyone. In today's video, we are going to be discussing risk factors of diseases and causal factors of diseases. We are going to be, differentiating them or explaining what risk factors are and what causal factors are. But I would like to tell you beforehand that nothing is absolute in this world. Nothing, absolutely nothing is absolute. So when we are discussing health, there is no way someone will say, once I do this, this will happen. It doesn't happen all the time. Sometimes we can be careful and bad things will still happen to us. Sometimes we can be reckless and somehow bad things will not visit us. This also happens when it comes to our health. So risks are behaviors that increases our chances of getting a disease. What be it microorganisms or just our careless behavior. But the fact remains that so long as you are behaving that way, or so long as you're doing whatever it is you're doing, your chances of getting that particular condition or the disease is increased. Remember, I have cited examples of diseases like pneumonia, diabetes, obesity, Huntington disease, Alzheimer's, cardiac problems. But causal factors are factors that ensures, factors. The best way I can explain causal factor is that without the causal factor, you are not going to get the disease. Let's use human immunodeficiency virus, for instance. Without HIV, you are not going to get AIDS. AIDS is acquired immunodeficiency syndrome. So HIV, the human immunodeficiency virus, is definitely the cause of acquired immunodeficiency syndrome. So having this HIV will make you have the other one, except if other conditions are met, because now we know that drugs can be used to reduce the effect of this virus in the body. Factors I'm going to mention includes age, sex or gender, hereditary or genetics, lifestyles, beliefs, and then our mental well-being or mental states. So now, I must repeat myself. There is nothing absolute about health. With all the causal factors we've mentioned and with all the risk factors that we've mentioned, it is not black and white. It's not like once you have one, you're going to get this disease. In order for someone to have a disease, there must be a host, there must be an agent. A host is, the person. There must be an agent, which is the microorganism or whatever other factors that could lead to the disease. And then there must be an environment that is conducive for such a disease. So when we look at all the risk factors that I had mentioned, we find that the ones like aging, hereditary, race, these ones we cannot really change. It is not in any way in our making to change them. But the other, so they are called fixed factors. But we have these other ones that are dynamic, such as our lifestyle, our belief. These are the ones that we can actively make sure that we control. However, be it fixed, be it dynamic, every risk factor that we have can be delayed. You can either reduce that risk or delay the outcome of disease, such that even though you are born with a particular genetic problem, your behavior, you can always do something in your lifestyle to delay the outcome of that disease, or to delay or to reduce the severity with which the disease would attack. The most important thing for you to note is that risk factor, causal factors, we all have something to do to delay the outcome of a disease. Risk to disease does not mean that you must have it, but it only means that you are making yourself vulnerable to a particular disease. Our job is to make sure that we reduce the risk that we put ourselves through. So if you are having a very healthy immune system, for instance, those that are fully vaccinated of COVID-19, then the possibility that when exposed to coronavirus, you will not be infected is higher than in those who are not fully vaccinated. I hope that this video has been able to differentiate these risk and causal factors, and we also matter. Our behavior also contributes to the outcome of any disease. We can help to delay, to drag, and even to prevent, in most cases, some of these disease outcomes. Thank you. Please like my video, speak to me in the comment section, like it, tell me what I'm not doing right. Thank you so much.